Hello, everyone, and welcome to this webinar. I'm Debbie Corso of DBT Path, emotionallysensitive.com. I'm going to get bigger on the screen in a moment. I just want to take you through the slide that's on the screen right now. Just to remind you guys that DBT Path classes and webinars are psychoeducational and are not intended to diagnose, treat, or cure any diagnosis or condition. Okay, so because we're in pretty much the first moment of the webinar and people are going to be trickling in, why don't we take a moment for those of you who want to let me know where you're coming in from tonight, where you're joining from, what parts of the world, and I'll look and see what you guys are saying in the chat box that I can see on my left here. All right, we have St. Paul, Minnesota in the house, New Jersey, the Netherlands, awesome, okay. British Columbia, Canada, Tampa, Florida, very cool, you guys. There are a lot of people in here right now, but not everyone's saying where they are, so I'm just seeing what's coming in. West Coast, Florida, awesome. Okay, you guys, well, welcome. And you can continue to put where you're coming in from if you want to. I'll be peeking over there. My name is Debbie Corso, as I announced earlier on, and as most of you already know before you even came here tonight. And I'm probably best known for the Healing from BPD community, which I started about 5 years ago now, 5 or 6 years ago, when I officially received the diagnosis of borderline personality disorder. And I know you guys are going to have questions come up, and I just ask you to please, if you want to, maybe jot them in Notepad or something and have them ready for the Q&A. I'm sure different things are going to come up for you in addition to the questions you might have planned to bring here tonight. So please do feel free to ask me anything. I'm pretty much an open book about this, and when we get to the Q&A, we'll do that. And my intention is to help you and to help you feel less alone and to feel supported and to feel encouraged and to know that you're not the only one on the planet that has certain things going on, okay? Now, receiving that diagnosis was completely life-changing for me in a positive way, and I'll tell you why, okay? And you'll have to bear with me. I have my allergies going on, and I just want to give a shout out to those in New Brunswick and Quebec, and then I'm gonna I'm gonna close down the chat box for a moment, and I'll bring it back when it's time to do some Q&A. Okay, just so they're all, including myself, not distracted by it. Okay. So about 5 or 6 years ago, when I was officially diagnosed, what that meant for me, that I knew that I had borderline personality disorder, or BPD for short, was that I finally had an official name for the collection of symptoms and things that I had been suffering from for so long. It made sense in a clinical type of setting to where this was a disorder that was known. This was a disorder that had a treatment that was shown to be very effective with a lot of people who have BPD. So that's what I mean by it was a positive thing. It gave me so much hope to find out that there was an actual treatment especially designed for people like me, with these symptoms, because up until that point, nothing really had lasting impact in terms of helping me to change and helping me to get well, helping me to sustain change. So I knew now that I had something that was well known in the clinical world, borderline personality disorder, and that it had a treatment called dialectical behavior therapy that was designed specifically for people like us, right? It's now widespread and used across so many different diagnoses and for people that don't even have a specific diagnosis. So, really emotionally sensitive people, anyone who really has difficulty regulating their emotions can benefit from this. And this is a set of skills that was created to help us to manage our emotions, originally created by Dr. Marsha Linehan, who herself struggled with emotion dysregulation, and recently in the past few years came out about this to the community and served as a huge encouragement and motivator to so many of us, right? So Yeah, so prior to receiving my diagnosis and being told, hey, there's something called dialectical behavior therapy that you can give a try, and this is supposed to help you, and we offer it here at the clinic that I went to at the time. Prior to that, nothing had really worked for me. And so by nothing, I mean I had tried one-to-one therapy. I had tried regular cognitive behavioral therapy, which I will say was effective for other issues in my life with anxiety and OCD related stuff, but not the stuff I was dealing with that turned out to be related to BPD. I had tried all kinds of alternative therapies. I had tried going to a life coach. I feel like I had exhausted my options. I went to all types of crisis clinics. I went to emergency rooms, psychiatric hospitalizations, like inpatients for weeks at a time. Some were voluntary, some were against my will, where I was there for like 3 weeks or so. All in an attempt really at the end of the day to try to get better, get well, to not feel so much pain and sadness and misery and loneliness and emptiness and despair. And these are things that any human being would want to resolve and feel better about. And so I definitely did my share of trying to get help and trying to find ways that would resonate with me and really click and that would last. But it wasn't happening for me until I found this therapy. And instead, what would happen oftentimes is I would do really well for like 3 to 6 months at a time, usually, and then I'd have a major crisis. So I'd get a job, and then everyone would love me, and I was a star employee. And then a few months later, I would have an emotional dysregulation. Something would happen in my life. Usually it would be like a few things that would happen at once, and I'd get really dysregulated about it. And I wouldn't know how to manage those emotions. So they would come out in inappropriate ways, and also in an inability to tolerate stress or distress. And so I would sabotage my jobs, start to be in the hospital and have like psychiatric appointments extremely often, to where I wasn't there to do my job, and then I would start the cycle all over again and over again and over again. That's one example. Another example was in relationships. So the types of relationships I had typically were such that I fell in love really, really quickly, really, really hard, and um, often blindsided, I guess, to the reality of the situation. And I think some of you guys can probably relate to that as well. Because one of the issues that was the biggest for me that ended up leading to my diagnosis of BPD when I was in an intensive outpatient hospitalization program was the lack of sense of identity. And how this sometimes showed up in relationships was I'd meet someone, right? Fall in love really fast. It was really intense. The person could do no wrong. I love them to pieces. And I didn't know who I was. Like I had little glimpses and little insights of who Debbie was and what I liked and what my preferences were and thoughts, but not very strongly. Instead, what I had realized I had been doing for my entire life up until the point where I just totally broke down in IOP and told the psychiatrist and doctors what had been going on. What I had been doing was basically becoming whatever I thought the other person wanted me to be, or whatever I thought they expected me to be, so that they would love me, so that they would accept me, so they wouldn't reject me, so they wouldn't leave me. So let's say I had a boyfriend for one of these years that I'm talking about who was really into baseball and was a Christian, and his mom liked to garden and so on. So those are a few things, right? I would very, very quickly pick up on baseball, learn everything about it, and become a fanatic. Even if I really didn't feel that genuine pull and interest, I would morph into someone who really loves baseball and was obsessed with it inside and out. And I would become a Christian and become obsessed with Christianity and the Bible and going to church and going to the church meetings and things like that. Okay, let's say there's a terrible, terrible breakup. Next person comes into my life, and this person is really into, I don't know, football. I'm just for lack of another creative idea right now. And maybe this person was into like mystical Judaism and something else. And then basically I would go from one relationship to the next, and I would suddenly be obsessed with football, and suddenly maybe the kind of music that he liked. He's into trance music. All of a sudden I'm into trance music big time. So it wasn't like I came into a relationship with, the religious one too. I would convert religions, um, and sexuality depending on the partner that came up. So, I mean, you guys can see how the identity piece was so huge for me, right? I know I'm jumping around a little bit. Just bear with me. There's so much to say. But yeah, so I would not come into a relationship whole and with a sense of identity, like a healthy person. So in a healthy relationship, you're not looking for someone to complete you or for you to become what the other person wants or needs or expects, because you're so afraid that they're going to leave you and that you're not going to have anybody and that you're going to be alone and you're not going to be able to tolerate that. That's an unhealthy relationship coming from a place, at least in my experience, of a lack of identity, which was the biggest, hugest thing for me with BPD. And I'll talk about what criteria I still struggle with. That's not one of them anymore. So for me to have gone from the type of person I'm describing to you right now to now someone who knows who she is for the most part. We're all always learning and growing and figuring out who we are along the way and changing. And, it's different though than having no sense of self and having no sense of who you are and where you stand, what your values are, what you won't budge on, what your preferences are, what your things that you love are, things that you're passionate about. It's very different than not knowing that about yourself and then taking on those aspects and attributes and qualities about the people that are around you. And for me, it wasn't just with boyfriends or girlfriends either. It was also in the workplace. It was in any type of social environment. And so what had happened was, when I was in IOP, I said to the psychiatrist who was treating me at the time that one of my biggest fears was that all of these people that I knew in my life at the time would get into one room and I'd be in the room with them and I would explode because I wouldn't know what to do, because if I behaved the way I did with Sally in front of Mike, Mike would think I was a complete weirdo, because that's not Debbie. That's another person. That's not how Debbie acts. Those aren't her preferences. That's not what she likes. She's into all the same things I'm into. And if I acted with Mike the way I normally would in front of Sally, she'd have the same reaction. Now imagine a room full of people. And so that explanation is what actually helped me to get my correct diagnosis. And so again, if I could go from being in that place, which I feared would be, along with so many of the other criteria of BPD, where I'd be stuck for the rest of my life, like I just didn't see how it would at all in any way be possible for me to get well from that, you know what I mean? And to assimilate into a normal life and to figure out who I am and to leave that behind. If I can do it, you can do it, is my hope for you. And my thought behind this is, I thought I was a hopeless case for the most part, but when I got into DBT, I said to myself that this has to work because everything else has failed. And I've tried so hard, that this has to work. And I'm going to give it my all. I'm going to do everything the doctors say. I'm going to do everything, boom, 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 all of the homework assignments, everything I need to do. I'm going to notice when I want to quit, just like they teach you in mindfulness, and I'm not going to, because I need this to work. And I'll tell you, it did for me. So now I do know who I am. I like her most of the time. I love her all of the time. So I do. I really do love myself now. And how can you really truly love yourself if you don't know who you are? And if you don't love yourself, how can you really truly love and connect to someone else? And that's why that was the foundation of most of my problems with relationships. It was very, very, very complex. It's so easy for someone to come from the outside, right? You guys, you probably experienced this. and have people judge you and call you crazy and unstable and dysfunctional. They have no clue. They just have no clue how deep it goes when you have BPD and how complicated it is and just how much work has to be done for you to get to a place where you can overcome these really serious things that we deal with, right? So now I don't have a boyfriend or anything, but I feel that I'm in a place where, for the most part, emotionally, I could handle a really healthy relationship at this point in my life, something I never, ever, ever, ever thought I could have before. Okay, so that's my big main thing of what led to my diagnosis of BPD and why I got the help and why I did. There are so many other things. I'm just looking at my notes here. I wanted to mention to you guys that this is very different from the webinars that I typically do. I meant to say this at the beginning. They're usually much more polished and have PowerPoint presentations and are more structured. But I figured that this would be a more raw, from the heart, keeping it real. Here's my story. Here's how I overcame type of thing. So just letting you know that. And that's the type of presentation you're seeing tonight. And I'm going to tell you a little bit more about my story, then I'm going to open up the chat box because it just feels kind of weird because I think you guys are sitting there like, I relate to that and I have questions. And then I just wanted to mention to you guys too that in order to have a diagnosis of borderline personality disorder, you have to meet certain criteria. And for years I did, even years before I was ever diagnosed. It was what was driving what was going on with me, with my emotional dysregulation and instability and all of that. But I no longer meet enough of the criteria to have a diagnosis of borderline personality disorder as a result of learning and practicing, fully integrating, and basically having become second nature for me, the DBT skills. And so this is the disorder where you can have hope that it can be overcome. Essentially, for me, the way I think about it for myself is by retraining your brain by using these skills. That's not to say that I don't have BPD traits. I still do. It's not to say that I'm not an emotionally sensitive person. I'm pretty sure I always will be, and I have been since I was a child. So I am very sensitive, and I do feel things intensely, and I do get dysregulated sometimes, but it doesn't destroy my life. It doesn't cause incredible suffering that just feels intolerable. It doesn't cause me to sabotage or to jeopardize things, whereas before, that's what would happen. But the two that and these aren't specifically in the language of the criteria, but they fall into the types of BPD type of criteria, is I still have an issue sometimes with black or white thinking. Maybe some of you guys can relate to that, to where sometimes, especially when I'm emotionally activated, I guess is the word, like if something happens that gets me, anxious or stressed or just distressed or dysregulated, it can sometimes be where I like see just the two things, like, oh my God, it's either this or this. And usually it takes someone from the outside, like a loved one or a friend or my therapist or my co-facilitator in my classes, is somebody that knows me and cares about me to say, Deb, is it possible you might be in black or white, all or nothing thinking right now? Could there be a shade of gray? Is it possible there's more than two options right now? And I love that, and it helps me immensely. And I'm very proud to tell you guys that about 2 weeks ago, I had an experience where I was able to see it, and I was so excited that I was able to see it. So, I mean, no matter where you are in the path, you have room to grow. And for me, that is one of my things. And the other one is, it's not really a criteria, but I think it's something that comes a lot with those of us who have BPD or BPD traits or who are in recovery, and even just a lot of emotionally sensitive people, is the issue of mind reading. So just thinking believing your thoughts and feelings if they're really intense, especially with regards to another person. So assuming that you know what they're thinking or why they're doing something, like assuming that you know their intention, that sort of thing, and then getting yourself in trouble when you go and check the facts. Well, you probably get yourself in less trouble if you check the facts, but ending up finding out that that's not really what it was. It was your emotional sensitivity and getting into emotion mind and out of that rational, reasonable mind, into a space where, you think something about what the person's intentions or thoughts are, and you can get dysregulated. And then you have to go and check the facts and then say, okay, maybe that's not what's going on here. And I find that going directly to the person that I have these concerns about and just straight up asking is the easiest, clearest way to deal with that particular issue. But other than that, for the most part, the feelings of emptiness and loneliness, not so much anymore. I'm not really doing anything um, else that I can think of on the list of symptoms and criteria. I don't self-harm. I'm not doing self-sabotaging things. I mean, every once in a while, maybe a little tiny thing here and there will surge up and want to happen because I feel so intense. And before the skills, that would have just turned into a knee-jerk reaction of just doing that thing and dealing with the consequences and damage control later. But with the skills now, I'm not going to lie to you, if you're emotionally sensitive or have BPD traits, even when you get well, when you're emotionally vulnerable, when you have a lot going on, when you're stressed, or if you get triggered, you may still have a surge in emotional intensity in reaction to something. You may feel like sabotaging. You may feel like doing all these sorts of things. I know because it happens to me and it happens to other people that I know very well who have this disorder and who are in recovery. The difference is you know better. And when you know better, you do better is the saying from Maya Angelou, right? And you're not perfect about it either. To me, the way that DBT Path got its name is I started thinking of those moments where I would start to get dysregulated during when I did meet the criteria and beyond. I would think of it as that fork in the road, which Dr. Marsha Linehan talks about, where you have to keep turning the mind. You can go down the old road or you can go down this road. And to me, I started thinking of it as you can go down that old road, the old, comfortable, familiar way of the dysfunctional, maladaptive behaviors that work in the moment to make me feel a little bit better for a short amount of time. Excuse me. And then I have to deal with consequences, maybe short term and long term, or I can go down the DBT path. So that's how the name came for that. And so when you are in a space where you're just done with destroying your life and done with sabotaging and done with all of the mess, and you say, I'm going to do these skills, I'm going to practice them, and it's going to be hard, and I'm not going to be perfect, and I'm going to mess up sometimes, I'm going to go down this road sometimes as opposed to the DBT path. But if you keep putting your intention back to, okay, I'm going to pick myself up, I know what my ultimate goal is here, I know that I'm worth more than this, and I'm just going to keep getting back up, and I'm going to return back onto that DBT path, then, life starts to change. Life really starts to change. So I don't want to just keep talking at you guys. I'm going to open up the chat box now. I want to give you an opportunity to ask me any questions you might have. Now, keep in mind when I say any questions, I'm obviously not a doctor. I'm not a therapist. So from a clinical perspective, I probably won't have the answers for you. In my online classes that I do, I co-facilitate with a licensed therapist. She happens to also be in recovery from BPD, and she's wonderful. Her name's Amanda, and she couldn't be here tonight because she's in a training in Texas. But I usually defer to her when there are those types of questions, and she's not here tonight. It's just me. But if you have questions about my journey or anything you think I might be able to answer as a peer, I'm happy to do so. And if you're like, I don't know if this question is appropriate, just put it in the chat box and I'll have to decide. So just, ask away. So, okay. I have Janny. I'm not sure if that was a typo. Maybe it's Jenny, or maybe it really is Janny. Hi, Janny. And I will only read your first name, guys, so don't worry about it. Okay, she said, no, it's good. Okay, Janny asks, if I may ask, were you suicidal? Repeatedly, repeatedly. And I would say I was sometimes genuinely suicidal, and other times I was not really suicidal, but I felt so desperate to be rescued, for someone to take care of me, for someone to make me feel safe, to have the structure of the hospital, to have someone take care of me, that I knew that if I said I was going to kill myself, or that I was having thoughts about it, or that I felt like it, and in a way, yes, to the outside world, of course, this looks manipulative, but in a lot of times, this is the way that people with BPD get their needs met. There were times like that too, Danny, where I didn't really want to die. In fact, I was terrified of dying. I didn't really want to hurt myself, but the only way that I felt safe was to be under really intensive supervision, like in a psychiatric hospital, because I felt so out of control and thought maybe I would do some, I won't give examples of the types of things I thought about because I don't want to trigger anyone, but I would thought, well, what if I just get so crazy that I blah, blah, blah. And, so I would get help for that. And then there were times where I truly felt extremely depressed and thought that I wanted to die. And that was probably the most intense, right around the time before I got diagnosed, because things just felt so hopeless. And I didn't think that my life could turn around and that I could have happiness, or at least a sense of balance. So I hope that helps, Jenny. If you have any follow-up questions, please feel free. Thank you for asking. It's a good question. I'm gonna take a breath. I talk a lot, and I'm not just here, but like outside of here. And it's like, okay, breathe. Okay. Let's see. Hi, Tracy. Tracy says, I've struggled with others' judgment and using my symptoms against me. How have you learned to address those who are judgmental? Whew, it's a heavy one, because I'll tell you what, you're probably very sensitive, right, Tracy? And for me, that was one of the hardest things about it, is that anyone would think that I did this on purpose. And this meaning the types of behaviors I outwardly exhibited, the inappropriate behaviors, the acting out, the anger, the suicidal gestures, and threats, going in and out of hospitals, to then have that thrown in my face in an argument, or when I wanted to do something and someone thought that I wasn't well enough to do it because of the way I behaved at the time. That hurt so much, and really just reinforced the cycle for me of, that despair and wanting to hurt myself or self-sabotage or go into the hospital or whatever. There were times when um, it was just intolerable. I'm sorry, I want to go back up and Tracy, okay, because I want to address Tracy, and your name went, but Tracy, there were times that it was just intolerable to handle other people's judgments. And I cared so much about what people thought of me and wanted everyone to like me, even pieces of crap people, you know what I mean? Even people that would hurt me. Even people that were strangers that I didn't know, that I met at a bus stop. I wanted people to like me. I wanted to be accepted. I had a very low tolerance for people not liking me, or people rejecting me, or people not wanting to have anything to do with me. So in the beginning, I didn't handle judgments very well at all. Through DBT, through learning. Okay, so there are 4 sections. There's mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. And through skills that I learned through each of those modules, I learned how to begin, and it's not to say that I never am affected by people's judgments, because you guys know I put myself out there on the internet, and people have their 2 cents and they're willing to put it out there. People are usually nice, but sometimes people will judge. Sometimes people in my family will judge. They'll assume that I'm people I haven't seen in a while will think that I'm still that same person who did that. Oh, you're going to go to the hospital now? And I'm just like, really? After all these years, Um, for me, it's about putting up what I call a boundary bubble, and many other people call it that too, to where I can hear what's being said and understand that that's where they're coming from and that's their perception and thought and feeling that they have about me and that they're making a judgment, but I don't have to receive that. I don't have to make that my truth and my reality and be completely destroyed by it. I can, it may hurt. It may still hurt that to know that someone thinks something like that about me or is judging me or feels that way can be painful, especially when you know that you can't change that. In that moment, you can't just shift and say, no, but think that I'm wonderful and that I'm totally stable. And, um, but it does allow me, what I try to do is practice something called radical acceptance, that I can't change that person's perception of me in this moment in time. That is what they think. And just because they think it and express it to me doesn't mean I have to internalize it and become destroyed by it. Doesn't mean I have to become completely dysregulated by it. Doesn't mean I have to believe it. Doesn't mean that I have to prove them right and then become completely dysregulated. So I do the best that I can to separate their stuff from my stuff, which was impossible for me before. I would just absorb everything and become completely dysregulated and derail by it, but I don't anymore. So I hope that helps and answers your question, Tracy, and makes sense. Please let me know. And if you have follow-up questions, please let me know as well. So Joanna says, are there any symptoms you still struggle with now that you are recovered? That may have come in before I was talking about it, or maybe Joanna just joined us a little bit after that. But Joanna, sometimes the black or white, all or nothing, the polarizing, splitting type of thinking, and also the mind reading or believing that because I have a strong thought or a feeling, intellectually, my wise, rational mind knows that, that's probably not an intelligent way of approaching a situation, is believing a thought or a feeling that's strong about what I think someone else's intentions are or why I think they did something or said something. But I still from time to time struggle with that. And for me, the red cue flag is when I get really emotionally charged in response to someone and I notice that I'm telling myself a story in my head like, oh, he's getting ready to move out, or, oh, he's getting ready to fire me, or, oh, you know what I mean? And I go, wait, time out. Really? What's the evidence? What's there to support this? Check the facts type of thing. But those are the two areas that, especially when I'm emotionally vulnerable or because there's a stressful thing going on, or if I'm not feeling well physically or something like that, those are the two that come up for me. And I would say the black or white splitting one, it doesn't even have to be like a ton of emotional vulnerability. It can just be like, like a trauma response is like, think about it this way. When you have black or white thinking, it's kind of like survival mode. It's kind of like this road is okay and it's safe and I'll live, and this road is not okay and it's not, and I may not. I still kind of go into that, and I have to watch it, and I have to be receptive to others' feedback about that. And I'm becoming more self-aware and conscious of it, which is like huge. It's kind of like I feel about the personality piece that I thought that could never be resolved. I kind of have stuck onto, especially because it's been so many years, that because I still have the issue sometimes with black or white thinking, which all human beings do, by the way. It's just more intense for us and often more frequent. I'm starting to have a teeny weeny itsy bitsy bit of hope that can also be resolved, because I'm starting to have more awareness of it. So thank you for the question. Thank you. Okay, let's see here. Natasha asks, what DBT skill do you most often use? I love, and maybe I've become a glutton and I have to watch that it doesn't become too extreme from time to time. I love a set of skills called self-soothing, which is in the distress tolerance module. For a lot of us with BPD or traits or emotionally sensitive, and I'll just say BPD for the rest of the webinar for the most part, just because it's a mouthful, and you know that I'm addressing anyone in those categories, you know, or who are in recovery. But for many of us, we didn't learn something, and I talk about this when we get into distress tolerance in my class too. There was a critical time in development where we didn't fully learn how to soothe ourselves when we were little, like maybe taking a doll and cradling it or different things. And for me, without getting into too many gruesome details, you know, I grew up in an abusive home environment. So I was in survival mode a lot of the time, and it was very frightening. And so I didn't fully develop my self-soothing skills at that critical time of development when I was little. And I bet a lot of you can relate to this. And so the awesome thing about self-soothing, which is something really all human beings need seriously to be able to calm yourself and take care of yourself when you're emotionally distressed and stressed out. Um, the great news is you can learn this as an adult, and it just takes practice and repeatedly turning to the skill when you need it. So self-soothing through the senses involves doing things that through vision, through smell, through taste, through hearing, through touch, that will be soothing to you. And it can be something as simple as purchasing some body wash that has an aromatherapeutic value to you. Like if you're soothed by the smell of coconut or pineapple or vanilla or lavender and you're feeling stressed, you get in the shower and you use this as, you know, to help you to feel a little bit better. Does something like this solve your problem? No, it does not. And it's not intended to. The distress tolerance skills, including self-soothing, are considered crisis survival skills, and you're to use them, or it's encouraged to us to use them when you're feeling like you're in a situation that doesn't have an immediate resolution. So you don't have a solution in that moment in time, but you want to keep yourself from making matters worse or sabotaging or going back to old behaviors. So there are these little things that you can do to take care of yourself. So that's just an idea. And, you know, for that period of time, while you're in the shower, using the aromatherapeutic body wash and taking care of yourself in that way, you're not doing other XYZ behavior that could be hurtful to you or sabotaging to you. So I love these skills. And, you know, I turn to them all the time. For sound, I'll give you guys another example. I'm kind of a talk radio junkie, and I find it very soothing and comforting to have talk radio on, especially when I'm alone, if my roommate's not around, because, you know, I get into the conversations, and it's nice to hear just the human voices, you know, on the radio show in the background, but it's also an activity, which is another DBT skill. If you get engaged in it and you start to listen to it and you allow your mind to be distracted by what's happening in the radio show as opposed to a problem you can't solve in that moment that's really stressing you out. So in my words, so you don't make yourself sick, because I used to literally make myself sick with stress. So that's my favorite skill set, is to self-soothe through the senses. That being said, I would say I probably practice throughout the year all of the DBT skills at one point or another repeatedly, because what happens is, from my experience and from other people I've talked to about this, once you learn them and you practice and practice and practice, they become so ingrained and so natural that you're just using them all the time. You've literally retrained your brain to not go to that old stuff anymore. For the most part, there will be times where feelings and thoughts and old triggers and old wounds will be so strong that you'll be tempted to go down the old road, and you'll have to. But for the most part, in my experience, and like I said, for many people I know, you get to a point where you're just living the DBT skills. You're doing them all. You know, you're turning to them and you're practicing them as part of self-care, not just when there's a crisis, not just when you're stressed out. So hopefully that helps. Thank you for the question, Natasha. Okay. Hannah says, I have BPD, but my significant other does not. What would you say to each of us in the relationship to help each of us? Well, that's a big question right there. And this is why I have on emotionallysensitive.com, make a note of it. There's a loved ones list, and your loved one, Hannah, your significant other can join it. And I send out stuff to them all the time. Like, here are some recommended books. Here's an awesome video. Here's an article so you can better understand your loved one who has BPD or is emotionally sensitive. I would say, to you, Hannah, you're doing the best you can in this moment with what you've got. And you're here, so obviously you have an interest in learning more about your experience and wanting to do proactive things to learn about your experience. And, understand that it's difficult, and you may already know this. So I'm just saying, based on knowing nothing about you, nothing about your significant other than you have BPD and he or she doesn't, understand that it is really difficult for other people, especially those who don't have it, to completely understand and to completely handle it sometimes. So I would say, for the sake of the relationship, for me in the past, looking in retrospect, I wish I had somebody tell me to really value and appreciate and let that person know how much I valued and appreciated that they stay by my side, even though I had ups and downs, and extreme difficulties. And I would also, if I were talking to my older self, and could give her this advice and look to her, I would tell her um, to express what was going on, to not just have these major mood swings and everything and not give any explanation. I would, to the best of my ability, give explanation so that that person could have some empathy and compassionately understand. And to your loved one, I would say join my loved ones list. Go check out NEA BPD, National Education Alliance for Borderline Personality Disorder. Check out the Family Connections program. There are so many things you can do to educate yourself, to learn more about this disorder and what it's really about, what sufferers are really going through, to increase your compassion, your knowledge level, and your skillfulness so that you can find out how you can better contribute to the relationship so that you're helping the situation and not potentially further triggering your loved one. You can't prevent all triggers, but there are some things that you can do in terms of validation and certain things that you can stay away from that could be helpful. So those are my thoughts on that. So thanks, Hannah, for the question. Summer, hello, Summer. Summer is one of my students at DBT Path. I think, unless someone is using the same first and last name as her, but I doubt it. So Summer says, Debbie, does the desire to be taken care of, rescued, be the center of attention ever go away, or do you just deal with it because you know better? Wow, I just almost got the chill. I started to get the chills, Summer, because that's such an honest question. To know that about yourself, to recognize that, to recognize that you might have that desire to be taken care of and rescued, or to be the center of attention. I would say, I don't know that it ever completely goes away. I think that even to this day, I still have that tendency come up, but I know that I can take care of myself now. I know I don't need to be rescued. And what I know most of all is that no one can truly rescue me. That's just an illusion anyway. Someone can temporarily comfort me and put a Band-Aid on it, but this is going to keep coming back unless I learn how to rescue myself, right? So I'm not going to say that those feelings never come up, or those thoughts, because occasionally they do. But you're right, I do deal with them differently than I have in the past. And I do think that the one with wanting to be the center of attention can be turned around in a positive way, like teaching and educating others and doing webinars and being on camera. I mean, what I want to say is these things about us don't have to be negative. Be taken and used to help others and to put good into the world. And you can get to that point. So hopefully that helps, Summer. Let me know. All right. Tracy's thanking me for earlier. You're welcome, Tracy. Gordana, I'm not sure if I'm pronouncing your wonderful name correctly. She says, thanks for sharing your beautiful story. You're very welcome. Thank you for being here. And then David says, what do you feel caused your BPD symptoms from when you were young? It's a great question, and they still don't fully know. I mean, one of the things that's suspected with BPD for a lot of people is what's called an invalidating environment when you're really young, and I certainly had my share of that. It's not that my parents were horrible all of the time. Again, they did the best that they could with what they had, where they were at, and they were young, and there were a lot of problems, and we were poor, and there were just so many things going on that were difficult, right? Um, but there was neglect and there was abuse. And I'd have to say that um, my relationship with my family was always pretty strained, even from kind of a young age. I was the one that was always acting up and rebelling and running away and all of that because I couldn't take it. And I was extremely sensitive, and it was so hard for me to deal with. One thing in particular, David, that stands out for me when I think of my story from childhood is my dad, because this is how I remember him, and this is why I'm pretty sure I have black or white thinking that was so severe and has been getting better over the years. It's probably true that there's a shade of gray in between. I just can't really remember it because I was in survival mode so much of the time because of his abusive, very angry nature. And I'm sorry for that background noise if you guys can hear that. It's my cat, and I don't want to have to keep getting up on you guys. He would be completely fine in one moment, calm, maybe sitting there watching a television program, everything's hunky-dory. You say one little thing he doesn't like, or one thing comes in his head that he remembers and he brings it up, and he would go from 0 to 25,000 on the anger scale in a second and become so dangerous and just abusive to whoever was around him. And so for me, it was dad is safe and he's in a good mood. Dad is not safe and I'm in danger. He's in a bad mood. So that had to have been, and that was repeatedly for years and years and years. As a young child, I would say that was one of the major contributing factors for me personally. Everybody has a story, and there are a lot of people who say that they didn't even come from any type of abusive or neglectful background, and I really don't know. I really don't have the answer to, even theorize what could have been the groundwork for them. Again, I'm not a doctor or researcher or anything, but that's from my story, what I suspect. Noemi asks, hi, Debbie, and Noemi is one of my students too at DBT Path. Noemi says, hi, Debbie, if I may ask, how did your family take the diagnosis you received? Okay, so I was in my early 30s when I received my diagnosis. Now, I initially was on one of my inpatient hospitalizations. On the discharge paperwork when I left, they said rule out borderline personality disorder. And I never followed up, and I never went back to that facility. This was in the 90s, and that was extremely scary for me to have that on there. I think that maybe Girl Interrupted had already come out, and I'm like, uh-oh, I don't want people to know I have that, maybe. So it wasn't until I was in my early 30s that I officially got my diagnosis. And so it scared people at first. They were like, what, you have multiple personalities? They thought it was like dissociative identity disorder, you know what I mean? To where it was going to be like split personalities and all of that. But when I explained what it was and started sharing materials with them, and really honestly, when I started blogging and then sharing my blog posts, because anyone who's been following me for a while on healing from BPD and now at the blog at emotionallysensitive.com, you know that I tell all, I mean, like I tell the details of my innermost experience. And because I'm a writer, I was able, Noemi, to really articulate that very well. And that's why a lot of people share my posts and videos, because they're like, she put into words what I couldn't explain to you. But that's what really helped. I would say, like what someone else had brought up earlier about the judgment, that happened a lot too, though. And I also got accused a lot of blaming my behaviors and my experiences on BPD. So that did happen a lot too. So thank you also to Hannah. Thank you, Joanna. You're welcome. Hi, Erin. Erin's a student also. We have a good mix of students and newbies. And Erin says, what environmental factors growing up do you believe played a role in your developing BPD? And Erin, I sort of addressed some of this with David, but I think a lot of it had to do with my dad, and a lot of it had to do with the neglect that occurred also, and also just not really ever feeling a strong bond, closeness with my mom. And that was really, really hard. Because my mom was always trying to protect herself and us. And she was the victim of severe domestic violence and abuse, and it was really hard to connect with her. And I think that was definitely part of it too. I was also bullied a lot in school. So that definitely, I think, had a contributing factor. Thank you for asking. Okay. Kayla's asking, hi, my name is Kayla. So Kayla says, have you experienced discrimination at a workplace or classroom setting? If so, how did you handle it? Not for BPD, because I didn't know that that's what I had. The last job that I had while I was in IOP, I did disclose to them that I had BPD, and they really cared about me there and became emotional, and they were scared because, of course, it sounds like this really scary, like, personality disorder. Again, thinking that it's like dissociative identity disorder or split personality, which is a different disorder and tends to be even more frightening for people that are on the outside and not having mental health issues like that, right? But no, I'm very fortunate that I haven't had that type of discrimination. I really hope that's not happening to you, Kayla. And if it is, I really hope you reach out to a trusted person. If it's happening at work, I hope that you reach out to your human resources. If it's happening at school, I hope you reach out to an academic advisor, because to me, that's unacceptable. And you have rights as a person who has a mental illness. So I'm sorry if that's happening to you or to anyone else. So yeah, I'm pretty open. So everyone at work knows that I'm in recovery from BPD. They know about my physical health issues. And it's not about a boundary thing too. It's just because I'm out there on the internet. So it'd be hard to hide it, you know? It's just, hi, Judy. And Judy says, how do you explain to your family or someone who really doesn't get BPD, what keywords, phrases can I say to at least help them to understand, especially when some things I have read to let someone know what it is like to be or have BPD. But what if a part explained to them is not exactly what is in the explanation? Something happened to you but didn't for me, both of us. You know what I mean? I would say, Judy, consider this assignment, student of mine. How about taking a resource like something like the open letter to those who don't have BPD, or my recent post on emotionallysensitive.com for loved ones, where I go into, hey, I'm not making excuses for people who have BPD, but this is really serious and there's a lot going on beneath the surface. What about taking one of those resources and then writing up your own, like referencing it, like maybe just saying, hey, there's something online I really want you to check out because a lot of it resonates with me, especially the parts about blah, blah, blah. The parts about don't particularly resonate with me. That doesn't apply to me. I can't relate. That's not part of my story. But other than that, like the parts that I told you about really help describe what I'm feeling. I'd love it if you'd look it over or watch this video or watch this film, and then we can talk about it. I just want you to better understand me and what I go through. And no two people have the same exact experience. So this lady's letter is not exactly what I'm going through, but gosh, it does a good job of helping me express a lot of it. And maybe see how that goes. Let me know how it goes, because I really want to know. Janny says, is it almost impossible for someone with BPD to have a relationship with someone who is like extremely non-sensitive? I don't think it's impossible. My last boyfriend, who's now like one of my best friends, is a very rational, not very emotional person. And I will say, as a very emotionally sensitive person, and especially when I was deep into the BPD symptoms, that could be really triggering because again, I would go into the assumptions that like, doesn't he know that that's going to be hurtful or painful for me? Or why isn't he like, at least sugarcoating this a little bit? He's very direct, very analytical, very scientific for his job, for his career, for his interests. And I will say it was not easy, but it didn't work out for us romantically, and I don't think it wasn't because of that. But we're the closest of friends, and um, I love him very much, and I did at that time too. And I don't think it's impossible. I very rarely think things are impossible anymore now. Come to see what I've seen so far in my life. I think it can be difficult, it can be challenging, and I think both partners have to be willing to compromise and to stretch and to learn about the other person, what they're going through and dealing with being a part of a relationship with someone who has BPD and someone who doesn't. I don't think it's impossible though, Danny. And Judy was sharing a little bit of her story with me, Judy. I did read that, and I'm so sorry. She has a lot of people in her life, but she still feels very alone. And I think a lot of us, when you have BPD, can relate to that. You could be surrounded by people, but still feel deeply alone. And I'm sorry that you're having that experience. It is one of the more, I would say, difficult things about depression and about that emptiness that we can feel with BPD. I'm so sorry, Judy. Additional messages, and I want you to know that that hope is so important, and that if you're starting to feel hopeless, I really want to encourage you to reach out locally to a crisis center, or to call one of the 800 numbers. I see you're in Canada, to find a resource, to talk to a professional who can support you and help you through this very difficult time. And please do it. Please, please seek professional assistance if you're starting to feel that way. Judy says, my other question is, you took 2 years to do a course, but now you teach DBT in 4 weeks. I am not good at doing self-help on my own. I'm better at going to a place or a classroom, but I can't afford to pay. But I'm on a long waiting list to do DBT group therapies for free. So I am feeling like I'm getting worse not doing anything right now. Thanks, Judy. Well, the first thing is I did it for about 2 years, once a week for 90 minutes or so. And I don't teach it in 4 weeks, and it's not a full DBT program. They're DBT psychoeducational classes. You're basically going to skills training. You're still going to want to get professional help and support. A lot of people talk about bringing the homework that they get in my classes into their therapy sessions for additional support and so on. It's not 4 weeks, it's 9 months. So each level is 4 weeks long. So distress tolerance has stress tolerance 1, 2, and 3, and each level is 4 weeks long. But the psychoeducational classes that I do here, it's a 9-month class in total, plus access to a mindfulness class that's another month. So it's actually 10 months in total. And yeah, so, and I hear this situation a lot too. In some areas, there are really limited resources. Waiting lists are very long. And I say, get out there and look at some of these more reliable websites like DBT Self-Help, the NIA BPD website that I spoke about before, National Education Alliance for BPD. Look at it might be helpful to you to look at my old blog, healingfrombpd.com, which I still update from time to time, or my new blog, emotionallysensitive.com. I try to give as much information as I can and suggest resources and workbooks and films and all of that so that you can do your best to self-educate. There's a woman on Twitter. Her name is Sue. I don't know her handle offhand. If anyone knows it who's in the chat room right now, please feel free to put it in there. She's self-taught, and now she's teaching professionals in the UK. So she had a very similar situation of not being able to have access to services, and she self-taught DBT, and now she's employed, I believe, full-time teaching professionals about dialectical behavior therapy and borderline personality disorder in England, in the UK. So this is amazing stuff, and you can do amazing things with it, and you can teach yourself an extraordinary amount of information to begin to get yourself going. For me, what I found was with all of that information scattered and not having accountability is what I would hear from a lot of people. And that's part of the reason why I created the classes, is because it is 90 minutes together every week with myself and a licensed therapist. We go over the material in a very structured way. We have homework time. There's an ability to get on and speak through your phone or the microphone, and we go over your homework if you want to, if you submit it, and we answer questions all throughout the class. So it's very different from the free resources that are out there, but if you need to start there to start somewhere, totally go for that, and to begin to self-educate. So thank you for sharing, Judy. And Judy wanted us to also know that she's 57. And don't think you're shocking me with that. I have people in my class that are in their 60s. I have people from in their late teens who have parental or legal guardian permission, and they attend with them, all the way up to people that are almost 70 taking the classes. It's never too late. It's never too late. Wow, Noemi was just letting me know that the experience with my dad was exactly like hers. Thank you for telling me that, Noemi. Sometimes I know I'm not the only one. I know better, but sometimes I feel a little vulnerable after sharing things like that, because I'm like, can anyone else relate? Was anyone else's dad like that? So for you to tell me that, I can't even tell you how much I appreciate your willingness. So thank you. Kayla says, I can relate to your childhood experience regarding your parents. Kayla, thank you as well. She says, thank you for sharing your story. Thank you, Kayla. Natasha says, about how long did it take you to gain a sense of self you felt comfortable with? A few years. I would say by the end of the first year of practicing DBT, I was starting to discover who I was and starting to believe that I was separate from other people, and starting to like the things that I was noticing about myself, and starting to realize that I had values that would cause me to become dysregulated if I would shift on them to please someone else. And I would start to practice my skills to set boundaries and limits, and find ways to be respectful in the context of a relationship or a conversation where I respected that person's point of view, but also kept my self-respect intact and stayed with my boundaries and my values. So by the end of the first year, I can remember starting to really, really feel like that. And I would say it's been an ongoing process since about year 2 or 3. Even when I wasn't continuing to go to DBT classes all the time at that point, just practicing the skills continue to allow me to develop that sense of self that I have grown to be comfortable with. So that's a great question. Thanks, Natasha. Let's see. Hannah says, thank you so much. I really appreciate you sharing your experience, strength, and hope with us. Hannah, you're welcome. You're very welcome. Kayla says, thank you. Let's see. Also in my classes, I'm not on the cam as much. Amanda and I aren't on the cam quite as much. We do a PowerPoint presentation. Sometimes we'll pop up in like a little box, but mostly it's discussion. We're talking, and talking with you guys. And you're typing in the chat box and we're addressing you. Summer says, Debbie, at what point in a romantic relationship would you recommend sharing your diagnoses? I think I have a whole article about that from the past of should you share your diagnosis. And it's really all about boundaries. Only you can make that decision, and it has to be from wise mind. I've learned about reciprocal boundaries, which is like, how much is this person sharing versus how much am I sharing? How intimate is this relationship? How necessary is it to divulge this? Would it be helpful for our intimacy to allow this person to understand why I am the way I am sometimes? It's really a very personal decision. And I'd say like all of those things and so much more are things I would consider taking into consideration And believe me, even as a person in recovery, I think about that, and I'm not even in a relationship yet. Like, how am I gonna, because I'm all over the net, and if they're gonna read this stuff, especially like in my early days when I was just like really dysregulated, um, when is the right time to tell someone? You'll know, Summer. You'll know. And it's a lot of factors you have to take into consideration. And it's all about the not impulsively divulging it because you just want to get it out there and over with and see if they're going to reject you or not or stay with you, and you just can't hold it in anymore and you just have to let them know. Not the time. Trust me. Trust me. Trust me. Okay. Janny says it angers her that that person that's more rational and doesn't have BPD and isn't emotionally sensitive doesn't show compassion. Yeah, I would get angry too at times, and it's just like all about. There are these books. They're kind of old. I haven't read them in years, but I remember them, like the 5 love languages or something along those lines, and understanding that people express their love in different ways, and it doesn't mean they don't love you or don't have compassion or empathy or care about you. They just may not show it in the ways that you've grown to need it, you know what I mean, or to expect it, or to think that it has to show up that way from that person to be real. Take a few more questions and we'll start to wrap it up, and I hope I see you guys in the near future, maybe in a class, maybe in a comment on my blog, or in a comment on my video, or on Facebook or Twitter. Natasha says, is BPD your only mental illness diagnosis? Um, I still have on my chart generalized anxiety disorder and OCD in remission, obsessive compulsive disorder. But I still have OCD symptoms that flare up, especially when I'm stressed out. So those are my DXs. I'm no longer on any psychiatric medication though, and I'm not recommending anyone goes off psychiatric medication. Please, consult with your psychiatrist, doctor, and do what makes sense for your treatment plan. But as someone who was on psychiatric meds since 13, it feels hecka good to be stable off of them. And it's been since, I've been completely off, I think now since February, around February, so of this year. So, Dee Dee? Oh, about my father. Yeah, I sometimes suspect that maybe my dad could have had BPD, or in the least, like some other severe type of personality disorder, and also bipolar. Like I'm like trying to analyze my dad, like from my layman knowledge. But yeah, he had something going on, Dee Dee, for sure. Janny says, amazing. I wonder how long the therapy would take for a person who is motivated to notice changes in their life. I think motivation is the key. If someone's forcing you to go to DBT or to like some type of therapy or treatment, I wouldn't expect too much. But you're there because you had enough of the crap. You've had enough of suffering unnecessarily and extremely. You just want to get your life on track, and you have it in you to do it because you're smart, because you're creative, because you have the ability to succeed in things, because you know that you have the drive. You just don't know how. Like, you don't have the tools, you don't have the skills. I think that's the place. When you're at that place, I have huge hope for you, because you just need that tool. You just need to be introduced to this tool that you can understand on an intellectual level and start to absorb it and practice it. And I think the time it's going to take to begin to see change is going to vary for everyone. I'll tell you, about 3 to 6 months into DBT, originally for me, I almost quit because I didn't see radical, huge changes. But what I came to find out is you don't need to see radical, huge changes that close up and, that initially. Just the little things would start to build upon each other and become really meaningful and help to create big shifts. So, yeah, I wanted to quit and drop out, and I didn't, and I'm glad I didn't. And I'm glad I could be here today to be that person that I wish I had when I was in your shoes, just tell you that there is hope, that you can come out on the other side of this, that you can get well, that you can have a life worth living, that you can thrive as an emotionally sensitive person, that just because you have intense emotions doesn't mean you can't succeed at school or at work or in relationships. It's all bullcrap. And so at least I get to be there for you guys. And someday I believe many of you, if not all of you, we may not be on the other side of the camera doing a webinar, but I believe you'll be in a place where you can give other people hope. So I just truly believe that. So let's see. Summer asks me if I'm currently in individual or group therapy. I go to see my individual therapist about once a month or once every 6 weeks. I continue to get my tune-ups. I continue to work through my stuff. And I was going through a really difficult time. Some of you guys know that I was diagnosed with multiple sclerosis a little over a year ago. And there have been some times where it's been really emotionally intense for me. And my DBT therapist, who is also my individual therapist, invited me to come back to DBT group to practice and to get, ideas for my writing and all of that. And so I have been going on and off back to an in-person group. So yeah, that's my situation. Oh, Janny says, God bless me. Thank you. Blessings to you too, Janny. Dee Dee says, how would you suggest to guide someone into DBT treatment who is very out of control of BPD and won't get help in tearing family apart? Walking away from them is not an option. That's hard because I know that there were times that people suggested that I needed treatment and I would just go into a rage. I wasn't ready to hear it. And I'm not sure that there's much you can do when a person is at that level. And I would say if you're dealing with something of that intensity, Dee Dee, that Amanda, my counterpart in the classes, the licensed therapist, would be a good person to ask for suggestions on that. I keep bringing up Nia BPD because I was just in touch with Dr. Perry Hoffman by email. She may even be here tonight. And she has incredible resources as well. And you may want to look into those to get some ideas and suggestions for that type of situation, which people deal with all of the time. By the way, Dee Dee, thank you for asking. I'm sorry that I don't have the best answer for you, but hopefully set you off in the right direction. Natasha's thanking me for this webinar and for sharing that and saying she learned a lot. I'm so glad, Natasha. Thank you. Noemi says, I watched a show on TV called Diagnose Me. Oh my gosh, I don't even know. I've never heard of it, but I'm like, uh-oh. She says, and they talked about the diagnosis of obsessive thoughts, which is part of OCD. Did you happen to have more of the obsessive thoughts as opposed to the compulsive actions? Yes, but I also had plenty of compulsive actions. But I for a while, they were like, oh, you're pure O, they call it, which is like all obsessions, no compulsions. But I definitely had compulsions. Kayla says, I always share your posts on my website, and it's called Minds Like Ours. Oh, I do. I think I've seen you have a Facebook page too, right? I think you do. She says, and this webinar has been extremely helpful. I admire your strength and courage. Thank you, Debbie. Oh, you guys are awesome. Thank you for making me feel appreciated and valued for bringing this to you. You guys are the best. And Janny says, push through. So glad you say that. Thank you a lot. You're very welcome. Thank you guys so much. I know there's tons and tons coming in. I'm doing my best to address as many as I can. We have a couple more minutes, so if you have a last minute question or thought, I welcome you to give it a try to get it out there. And I want to thank you for spending time with me today. And I mentioned, keeping in touch and keeping up with what's going on and what I'm putting out there. I'm going to put something up on the screen. I'm going to get really little for a second, and then there's going to be something else on the screen. I just want to walk you through this so you know how to follow me and follow up with what I'm doing and continue to get resources and ideas and so on. So let me go ahead and put that up there. And you guys can ask me questions about this too if you want to. So my website is emotionallysensitive.com. It's also dbtpath.net, but most people know now that it's emotionallysensitive.com. And that's where I have my blog, my online psychoeducational classes that are based on DBT skills training that you're all welcome to come and check out and see if it looks like it might be a good fit for you where you are in your journey now. If you want to come learn from me, Again, it's not like I'm on the screen like this, like in this webinar. It's more PowerPoint. Amanda and I come up a little bit on the itty bitty sometimes, but it's packed with stuff. You get homework every week. There's a private, actually it's called Secret Facebook group, and it's set up so that your connections don't know that you're a part of the group, and they never see any of the stuff in their feed. So it's set up to secret. And there's just there's a lot that comes with it. So just go check it out if you think you're interested. I don't want to like take a ton of your time talking about it. If you're interested, you'll go and you'll see all this stuff included and whatnot. I have another class starting July 13th. You can sign up and get on the list to be notified of when registration opens, which will be like probably just a week right before that, maybe a little bit longer. And then we're closed off again for 3 months until we do the next module. So that's how it works. But there's a list you can get on, and then I'll email you and let you know when registration opens in case you want to sign up. And then there's my Facebook page, facebook.com/DBT Path. And DBT Path is my Twitter handle. It's my YouTube name, and it's my Pinterest name. So that's how you can stay in touch and follow me. And then I have a webinar coming up for loved ones, and it's going to be with Amanda Smith. And if you have a loved one who may be interested in that, you can give them that information. That one's not free. It does have a small charge. Amanda's going to be on with me, and I will compensate her for her time. So that's emotionallysensitive.com/summer 2015. If you have loved ones who want to better understand this, who want to ask Amanda and I questions. And we're going to be talking too about kind of interesting things like we're both not doctors, but to the best of our ability and understanding, we're going to be talking about the physiological aspects, you know, of what happens sometimes when we're emotionally activated as emotionally sensitive people and these intense mood swings and so on with BPD. And we're going to be there to answer questions for family and loved ones. So that's another resource you might want to look into. I was going to hold up cards like this. I was like, ooh, I could get really low tech and hold up cards and hold up, you know, can't even find the other one now. Getting really tired, getting giddy. This is the one for your family members. Okay, guys. Well, I just want to thank you so much for taking the time out of your day to be with me, to show up here, to listen to my story. Let me go big again. To ask your questions, to give me the opportunity to answer them to the best of my ability, and to let you know about, you know, where I am on the web in my space. You know, you guys, healingfrombpd.com was the blog I first started. And if you go back, especially to the older posts, you can really see the transformation over the years. Like if you go to the archives page and start at the bottom and start working your way up, you're like, whoa, you can see the change. And so emotionallysensitive.com, I do go there. I do talk about the most painful and difficult aspects of having BPD or being emotionally sensitive, and I address those issues. And I talk a lot about recovery too, because I'm there now. And there are a lot of people who are there who can resonate with that. And there are a lot of people who want to be there, and they resonate with it for that reason. They want to see what it's like, potentially, when you get to that point. So I have a blog there. Come on over to it. Follow the Facebook page. Come to my new space on the web. I wanted to tell you guys all about it. So anyway, oh, there's some more in the chat box, and then we'll close this down for now, you guys. Dee Dee saying thank you. You're welcome, Dee Dee. Summer says, just want to say you're doing an awesome job. This webinar has been tops. Thank you, Summer. And I know you love for me to get on the webcam. You're like, get on the webcam during class. She's taking votes. Like, how many people think that Debbie should get on the webcam? I'm like, all right. Thank you so much. It means a lot. Janny says, would you happen to know if this DBT training is given in Holland? My class is worldwide. It's online and it streams live. And if you're in a time zone where that's not a good time, it's recorded, and the recording is sent out to you each week to watch on your own time. And then you can interact in the Facebook group 24 hours a day. As far as DBT training for professionals in Holland, I'm not sure. But definitely look into it if that's what you're thinking. But if you're looking for yourself or a peer that wants to come and learn the skills, I have students from all over the world right now, all over the world. So I'm going to read Judy's comment. She says, Deb, just wanted to let you know I did share your open. Judy, you're the one that just posted on Facebook saying how excited you were and you were coming now. I know, just made the connection, Judy. She says, I just want to let you know that I did share your open letter on my status on Facebook, sharing I had BPD, that this letter can help explain what it is like for me. Plus, I shared the story about Marilyn Monroe. Yeah, it's one of my most popular posts, too. Being BPD, probably, and The Candle in the Wind by Elton John, and said on my status that I can identify with her, too. Debbie, thank you so much for everything. I appreciate this webinar. Judy. Oh, you're very welcome, Judy. Thank you, guys. We did it. We did it in 90 minutes. I do these live things a couple of times a year. I really feel it's important to get out there and connect and let people know that they're not alone and that there's hope. And of course, let them know what I'm doing out in the world in case it's of interest to you at this particular junction in your journey. So thank you again, guys. It's been awesome. Thanks for spending part of Saturday night with me for those of you who are in this hemisphere and area. And the next day, wherever you are in the world, thank you for taking time out of your day to spend with me. I've been so looking forward to this, and I had a great time with you guys. Thank you. And I'll see you again in the next video, blog post, or should you be in my class or somewhere out in the web, Twitter. Bye for now.